The term cyanosis refers to a bluish discoloration of the skin and/or mucous membrane due to increased amount of deoxygenated hemoglobin. Deoxygenated hemoglobin greater than 5 mg% in capillary blood leads to cyanosis. There are 4 types of cyanosis, namely central, peripheral, mixed, and differential cyanosis. Central cyanosis occurs due to diminished arterial oxygen saturation. To identify central cyanosis, look for bluish discoloration in tongue, lips, and skin. Also note that in central cyanosis, the temperature of the limbs appear warm. It is usually associated with clubbing and polycythemia. The inhalation of pure oxygen improves the cyanosis. Central cyanosis can also occur due to buildup of abnormal pigments, like methemoglobin and sulfhemoglobin. The levels of methemoglobin and sulfhemoglobin should be more than 1.5 grams per deciliter and half a gram per deciliter respectively, to cause cyanosis. Peripheral cyanosis occurs commonly due to diminished blood flow to a local part. To identify peripheral cyanosis, look for bluish discoloration in fingers, toes, tips of nose, and earlobe. Note that in peripheral cyanosis, the temperature of the limbs appears cold. The cyanosis does not improve with the inhalation of oxygen. Mixed cyanosis is a combination of central and peripheral cyanosis, that is, decreased oxygenation, with sluggish blood flow. The underlying pathology in the case of mixed cyanosis is often cardiac in origin, such as cardiogenic shock and CCF. If the cyanosis is seen to affect only either of the limbs, it is called differential cyanosis. Differential cyanosis occurring only in the lower limbs is attributed to patent ductus arteriosus, with reversal of shunt. Differential cyanosis occurring only in the upper limbs is due to patent ductus arteriosus, with reversal of shunt, in transposition of greater vessels. Differential cyanosis, in both upper and lower limbs, is suggestive of patent ductus arteriosus with reversal of shunt, and preductal coarctation of shunt. Here is a simple way to identify the type of cyanosis. If the patient presents with cyanosis of the tongue, with warm extremities, it could indicate central cyanosis. If the patient presents with a pink tongue and cold extremities, it could indicate peripheral cyanosis. If the patient presents with cyanosis of the tongue with cold extremities, it could indicate mixed cyanosis. And, if only the upper or lower limbs appear cyanosed, it could indicate differential cyanosis. 2 important terminologies associated with cyanosis are orthocyanosis and acrocyanosis. When cyanosis occurs only in the upright position, it is known as orthocyanosis. It occurs due to hypoxia in the erect position, which results from arteriovenous malformations. The term acrocyanosis refers to a persistent, bluish discoloration of extremities, commonly observed in hands, feet, and distal part of the face. Acrocyanosis is caused by vasospasm of the small vessels of the skin, in response to cold. Acrocyanosis is also common amongst healthy newborns. It is important to note that cyanosis does not occur in severe anemia, with hemoglobin less than 5 grams%, and in case of carbon monoxide poisoning. The amount of deoxygenated hemoglobin, in severe anemia, will always be less than the critical threshold for cyanosis to appear. In the case of carbon monoxide poisoning, carboxyhemoglobin prevents reduction of oxyhemoglobin, and the former has a cherry red color. Hence, cyanosis does not occur. The differential diagnosis of cyanosis includes pigmentary birthmarks, large tattoos, drugs causing gray-blue skin, like imiodarone and silver, blue clothing dye, and the consumption of blue-dyed food. BasidiaMED. The easiest and fastest way to take advanced clinical history.